Welcome to Thursday Thought Leaders for BW Healthcare World. My guest today is Dr. Om Manchanda, who is the Managing Director of Dr. Lals Pathlabs. Prior to serving as the Managing Director, he has served as the CEO of Dr. Lal Pathlabs for over 12 years. He joined the company in 2005 as a Chief Operating Officer, and prior to that, he has served with companies like Hindustan Unilever, uh, Monsanto, and Ranbaxy. Welcome to BW Healthcare World. Let me first listen to you and the story of how Dr. Lal Pathlabs has grown in the last few decades. What has been the philosophy and how did Dr. Lal Pathlabs disrupt the industry when including a lot of firsts that they have done?
I think it's a fairly old company. It started in 1949 and by Dr. Major S.K. Lal, which is Dr. Lal's father, in central Delhi in Hanuman Road, which most Delhiites are very familiar with. I probably in brief tell you about this journey. In fact, actually, we can go on talking about this. There's so much to talk about our story of the past. I think first, I would say Dr. Lal Pathlabs over a period of time has become synonymous with pathology. So the moment you think of pathology, you think of Dr. Lal Pathlabs. And how did we reach this status of being synonymous with pathology? I think number one, we've been pioneers in many things. Over a period of time, Dr. Lal Pathlabs has introduced lots of tests which never existed in India. You know, these tests actually come from Western world. A lot of these vendors, they bring these tests. There's hardly any awareness about these tests. So they need somebody who actually picks them up and takes it to the market. So I think I would say number one thing has been Dr. Lal Pathlabs has been the lab or the company which has been taking these tests for the first time in India. So we have been pioneer in introducing many such tests in the country. The second big ticket item for us has been over a period of time quality. We have actually been very, very stringent inside the company as well as with the accreditation process by College of American Pathologists. We have been the first lab to have these accreditation in place. And both owners being doctors, they actually instill the culture of quality in the system. And with time, because it's been for many generations, people have used our lab and it's been tested by multiple sort of stakeholders. I think everybody has endorsed us for quality, and we have over a period of time earned a reputation of being a quality lab. I think that's the second thing I would say. The third, I think, to my mind, which has had a very huge impact commercially as well as on the scale, is our business model. For the first time, Dr. Lal Pathlabs actually went out to franchise collection centers. I would actually say I would probably split this step in two parts. One is the entire hub and spoke model itself. There was a time, or even today also, a lot of these small-time labs, they just do testing, collection, and reporting from the same place. You have one lab run by, let's say, a doctor or a technician run labs. You walk into that lab. All the three broad activities of collection of sample, testing of sample, and delivery of report essentially has been happening from one physical outlet. To my mind, the sort of a real defining moment for what Dr. Lal Pathlabs is today is when we took away the collection part closer to the customer. And then we bridged this whole thing through a logistics network. And to me, that is the real sort of innovation and business model. Post that, we've been able to scale this entire collection network through franchising. I would say that actually has been the defining moment, and that really has helped us to where we are. So to my mind, a business model innovation coupled with the very, very laser sharp focus on quality has brought us to where we are today. and overall layered with quality of management. And as you mentioned, my entry into the company, I don't come from healthcare industry. I came from, as I mentioned to you, companies like Hindustan Lever, that kind of experience. So I had plenty of experience with me on the commercial side, worked for large scale companies, and also consumer focused. I think that's journey which I'll talk about post 2005. We completely transformed the way pathology is being presented to the market. We took it away from, we actually made it a consumer facing industry.
So, Om, you've been one of the few people who spend a lot of time in the industry, in the diagnostic space, in pathology, and you came from a background which is not related to this business.
Right.
How have you observed the change in the consumer behavior and how the industry has responded to this change?
So it's a great question. In 2005, when I joined this space and this company, my task was clearly cut out. So we had to grow the business, right? I quickly realized that I probably going to not add much value on the medical side of it, because the company was well known on quality, and they were doing entire test menu, etc. I think my sort of contribution would have been on how do we really increase the business itself. So we then, having come from consumer background, and I also had seen in Ranbaxy, because I was in consumer healthcare division, which is OTC division, and there at least that the drugs that are sold in OTC businesses actually are sold through both the channels. You reach out to doctors as well. You also directly advertise to patients, which is over the counter. To me, that actually experience came very handy, and we realized that there will be a doctor promotion side, which is already happening. You meet doctors, you do a lot of CMEs, etc. But there is a consumer angle to this whole business, and we realized the consumer angle essentially is look at those pain points of the consumer. The first pain point we realized was the patients actually come in the morning, give blood sample. Then again, they keep calling up, asking whether the report is ready. Then they again visit the lab to collect the report physically. And those days, of course, these consumer apps and WhatsApp, they were not there. But we realized that you can easily email these reports to these patients, or through website they can download. I think that part, downloading, came even much later. We started actually emailing these reports. So then we realized that you're actually saving the patient's second visit to the lab. So they don't need to come. So I think that was the first point. The second was actually top of mind awareness for the brand itself. I don't know if you grew up in Delhi, you would have known the color scheme of a brand was very, very different. And in 2005, again, I would say that given my consumer background and creative agency background, we looked at all the colors of our brand, and we just changed it to ochre yellow. And all our collection centers is like a retailing. You have a retail stores, and we opened so many collection centers in Delhi. And overnight, the brand was extremely visible. And I think the people in city of Delhi could feel it, that there's something happening with this brand. And we changed the completely walk-in experience as well. Whether it's a simple thing like queue management. I don't know if you recall going to our labs 15, 20 years back, there's so much of crowd and you're fighting for your turn to come. And, in our country, you're always fight to be ahead in the queue. And we actually put up a very professional queue management system. Small things like they were being appreciated. Simple things like how do you engage with the customers while patients are waiting inside our labs? We started building content. We started actually having some kind of information on our walls itself. I'm going back to 15 years back. So I think all this put together, I would say we started engaging with our patients. It became a more consumer focused brand. And with time, we started promising that we'll deliver the report on time, we'll deliver the report the same day. Just one thing built over the other. I would say broadly the platform of service started taking shape.
I've actually experienced this transition since I've been born and brought up in Delhi, from being standing in a queue at Hanuman Road, and especially when you're going for a pathology test, when you're empty stomach, You want to
Yes, yes,
fast, and then you have to
absolutely.
come back again with a post test.
Yeah, PP, yeah, correct.
Yeah, so these are small changes that actually make a big difference. Om, do you think that the market is going to grow differently than what we have seen in the past few decades? And one of the changes that I'm observing, which triggers this question, is that there was a time when you would go to a doctor and doctor would prescribe the test, and that is when he will also guide you to which lab to go to. To today, when we are doing a D2C business in pathology, uh, how do you think this transition is being managed, and what is the impact that it's going to create in the industry?
No, I think you're absolutely right. And over a period of time, I have observed that not only just pathology, I think overall our attitude towards health has changed. At a macro level, it's very clear, obviously, as the income levels grow, as the awareness about health also grows, you actually become more proactive in taking charge of your health. I would say that our visit to doctors earlier used to be when you have certain symptoms like either you have a fever or a pain, right? Unless you reach that stage, you don't even think of going to a doctor. And today, actually, we've reached that point where we are saying, listen, I'm not going to go to a doctor only just because I have seen some symptoms. I want to know whether everything is all right with me. I would say even there is a certain section of society which is even saying, listen, even if I have a family history or I want to know what is my DNA makeup, I want to be a little more careful about my lifestyle changes that I need to make given my genetic makeup. So, to my mind, if you stretch the spectrum of being prescriptive, it's become more preventive, and I think it's moving towards more predictive as well. So, if I look at the consumer dimension, it's moving from there. So, what is the impact of this on the overall size of the market? It was only prescriptive, then I would say the demand is generated only if I see a doctor, because doctor is going to write a test. But if it's preventive, that to my mind, you and I can decide on our own that I want to get my health checkups done, right? It's happening without a visit to a doctor. If it's more predictive, then actually it's happening very early in life stage. And then you would say entire universe actually is your market as well. While it may not be 100%, but I think the market is expanding because it's moving away from prescriptive to preventive to predictive. That's the way I would look at it.
Right. And how is technology shaping the diagnosis domain in India? For example, when we see artificial intelligence, it is impacting the diagnosis itself and the quality of the diagnosis that is happening today. Also, maybe you would want to also comment along with AI, the quality of the equipment that is getting better day by day. Uh, would it create better quality diagnosis, and also would it create access to the rural India as far as diagnosis is concerned?
Yeah, in fact, if I just look at 18 years I've been here, from the way labs used to look then and the labs look now, they are like chalk and cheese. Uh, I think they are much more automated than before. One variable that has led them to become automated is the scale itself. Because the number of patients visit then and number of patients visit now is like 25, 30, 40 times more. So that has led to a high level of automation in these labs. Uh, Test menu then and now is completely changed, and a lot of high-end tests have come in. Uh, and I think that's where I probably would say the technology has made a lot of contribution and will continue to actually add value to it. Third is on service side, as I mentioned to you, a simple thing like emailing the report. Now, actually, it's all happening on the app itself. So you probably don't need to even do a first visit also. You do a home collection, you book online, pay online, schedule an appointment. Here, technically the guy who collects the sample is going to your house, and then you get a messages. Your report is ready, and the report actually comes on your phone. You didn't even touch your touch points have completely changed. So I would say that it's completely transformed the way pathology was being delivered then and now, on both on the all the dimensions, whether in terms of automation or in terms of test menu and in terms of service levels. I think the other thing that you talked about is how is AI helping the pathology business. To my mind, it's going to contribute immensely both on diagnosis quality as well as on productivity. Let me touch about the productivity first. Uh, it's often mentioned that there are 300,000 labs in the country, but there are no 300,000 pathologists. Many of these labs are run by technicians. Now, to provide that oversight of a pathologist on these labs, technology can play a very big role. And manual intervention is generally when you see hematology slides or blood smears, or you see tissue biopsies. And these days, you can actually scan these slides and beam them to some remote location, and then somebody is reading these slides. So you can actually enhance the productivity in the system. Okay, that's one big change. Second is, of course, you're writing a lot of algorithms to pick the lesions much early. Then let's say human eye can do that, and it's a lot of these applications has come in the area of radiology, but we are seeing even in digital pathology or histopathology. A lot of this is being used in our system. So AI is going to contribute quite a bit on both productivity as well as on quality of diagnosis.
When we look at rural health and rural diagnostics, I mean, one thing that you mentioned is the lack of talent, trained, skilled talent in the country. Second is the logistics. So even if some people who have tried hub and spoke model, where the sample needs to be collected and then brought to a central lab where it can be tested, the journey itself can spoil the quality of sample. So how is technology helping companies like yours to be able to serve or start serving the rural India? Is that on the cards?
I think in fact, many conferences that I go and people normally talk about to solve our healthcare problem in the country. And I personally believe that the challenges in healthcare in India are less clinical, more management. The issue of affordability and access actually can be resolved through management solutions. They are not clinical solutions, right? The quality wise, I think our country is way ahead. And to solve these problems, I think one thing which is in our favor is scale, because sheer size of our country is actually, while it may be a challenge at one level, but it's also an opportunity to build a scale business. And I foresee that, let's say our central lab in Delhi, for many years, it served the entire country actually, because the samples used to travel from every nook and corner and come to Delhi. But today, that's not the situation. We have built many reference labs across the country, whether it's in various zones, south and east and north and west. Similarly, I do believe that these reference labs will go deep into the regions as the scale picks up. Let's say tomorrow, if you have a lab in Lucknow, and sample doesn't need to travel to Delhi, right? So Lucknow is the last stop. The moment you have a big lab in Lucknow, then technically you can actually go one level deeper. And I think that's where the access will grow. And to my mind, it's actually a flight, which is, if it's a one-stop flight, it's a manageable. If it's a two-stop flight, then there's a problem. Right. So technically, what we need to do is take these high-end tests in the region and then go deeper. And eventually, it's a chicken and egg story. Now, what stops us in building these labs now, right? That's a question somebody can ask. I think to my mind, it's linked to the scale. As we grow as we grow bigger and bigger, you have economies of scales in place so that you can take these labs deeper. While at a macro, as the economy grows, as the healthcare awareness grows, and overall demand will grow, scale also will fall in place. So I think it's just a virtuous cycle that's falling in place as we go along.
And also, Om, have you observed the relationship between a doctor and a pathology lab or a diagnostic lab changing over the last few years as the technology advances? Because apart from what the doctor is wanting to know, there is much more that the lab can provide. Since you were talking about that lesions can be known much earlier, and there can be a lot of predictive diagnosis that can happen. So do you think the relationship between the doctor and the lab is going to change?
I think so. I think going for, let's say, if I think quite 10, 15 years ahead. Clearly, the market is getting vertically split. So there's a preventive health checkup, there's a chronic disease, which is a very routine test market. Then there's other bucket where complex diseases, not able to figure out what the problem is. One is struggling to connect many dots together to find out what the real disease is, right? And there are many diseases which are actually getting manifested. We never actually bother about that. And I would take example of autoimmune disorders. They are becoming very, very common and were not getting diagnosed early. But I think with the interaction of pathologist as well as clinician, based on the history of the patient, you can actually make early diagnosis. I often say that what is the problem we are trying to solve? The problem, there are two issues that we solve as a proposition. One is to diagnose it accurately, right? That actually is happening. But the second is diagnose it early. There's no point in diagnosing it late stage when you can't do much about it. It's important to diagnose it early. I think that dimension requires a 360-degree interaction in the healthcare ecosystem. I would say I would even bring in patient also in that interaction. It's not just only the doctor. Because unless the patient shares the history, not only recent history, but entire history of various symptoms over a period of time the patient has observed. And I think that can actually make a big difference in diagnosing it early. So, and that's where the technology, AI, etc., would fall in place. And I think many of these data points which we pick up through wearables, etc. So I think it's going to be interesting sort of future I can see in front of me, where a 360-degree view of an entire patient journey can help diagnose something early.
This is something very important that you brought up because, diagnosis from the healthcare industry point of view can only happen if there is a first step taken by the patient. And I think
Absolutely.
we are on that journey because post pandemic, I think people are becoming a little more conscious and mindful about their health and remaining healthy. I mean, it's not just about illness. Uh, you know, how is the diagnosis space panning out for chronic diseases you just mentioned? I mean, for example, like cancer and all. Now, there is a growing focus on personalization of treatment. Do you think genomic testing is going to become a regular test in times to come?
Actually, we are already seeing in oncology, a lot of genetic testing actually happens to decide line of treatment. So it may be one specific use cases, but I have a feeling that personalized medicine is going to become a probably, if not in near future, but maybe in distant future, a way of life. So, and not just genetics, on multiple factors, you will actually decide what drugs works, what are the drugs that work best for you in a particular condition. So I think I'm pretty hopeful about personalized medicine. So it's going to become very important as we go on.
So you think it may be more from the preventive side, initiated by the person himself rather than getting ill and then the doctor prescribing the test? Do you think that's going to happen?
I would not say that it will apply to the entire population per se. It's a very small percentage at the top, which are highly aware, educated, people who can afford it, because these tests are not going to be that cheap as well. So you need to have a affordability. I think at that level, a lot of people are actually going to figure out is that is there something personalized for me. But directionally, if you were to ask me whether if you're sitting today at one point, 5 years from now, I think personalized medicine would actually have a very important role to play.
And how big is the diagnostics industry in India as on date? I mean, if you would want to comment on the size of it in terms of the value of it, the revenues that it generates, and also what do you see as a prediction for the next 2 3 years? I mean, had I asked this question say a decade ago, the scale at which we were growing was very small compared to what we are experiencing today. So where do you think the industry would be in the next 2 or 3 years?
Actually, unfortunately, unlike other industries that I've worked, so we used to have so much of data flow on a regular basis. That data flow doesn't happen in diagnostics. In pharma industry, monthly, every month you get data. In consumer industry, you actually get off-take data, you get secondary sales data. I think there's so much you can actually know that which way the industry is growing. You can actually estimate the size also. Here is one of data that's been available in a particular report, and then we keep quoting that number. By some numbers, if I remember correctly, I think the industry size is being talked about $6 to $9 billion. Half of it is radiology, half of it is pathology. But I think the most relevant number is organized market. Other day I was doing some analysis about 4 or 5 companies at the top. Some of them numbers are available in public domain. They constitute about 10 to 15% of the market. I think the runway is still long because 80-85% of the market is yet to become organized. And it's not that many of us who've actually come have filled a gap. Essentially, the entire unorganized shift has happened to organized. And that shift is a constant sort of I would say, process that's going on. And as the activity in the organized space continues to grow with more and more competition coming in, that acceleration is further growing. And to my mind, I think that shift is what is actually making the organized market grow. And we still have a long, long way to go.
Where do you see the ratios change in the next 5 years, sir, between the standalone clinics, which is the unorganized sector, versus the organized chains?
I think it's a great question. And often I get asked is that, can this market be organized to the extent of 70-80%? My answer to that probably is not really. There's a certain reason why this industry remains fragmented and will remain fragmented to some extent. You may not have too many, like 300,000 labs, but you will still have hundreds of labs. Primary reason for that in healthcare, I would say, is that there's a relationship angle with that you can't replace. You and I still want to go to a doctor whom we trust. You and I still want to go to a doctor whom we have checked with our friends and families, who is a good doctor. And there is a bit of a comfort when you meet somebody, right? So same relationship exists with the healthcare facility, same relationship that exists with a particular person. So to my mind, those relationships cannot be easily replaced by a large-scale network. So to my mind, and there are people who actually are looking for that personalized, not only personalized medicine, but personalized service as well, right? I know for people who actually swear by certain labs, say for ages we have been going to that lab, we'll continue to go to that lab. We will continue to see that doctor as well. So to my mind, I think fragmented nature of the industry will remain. But I think the question that you asked me is to what ratio? It's very difficult to put a figure. I don't know, if I'm forced to make a guess, it may just be about 15% going up to 30%, 35%.
And also, I want to ask you one question, which is triggered from your last answer about the good doctor, trusted doctor. What has changed in the last maybe 20, 30 years is that from a time where doctor was trusted blindly or people had faith in the doctor, people have seemed to have lost faith in the healthcare domain. People look at a healthcare practitioner with an element of doubt in terms of its sincerity. Do you see that happen in the diagnostics business as well? And what do you think will bring back that faith in the system?
Yeah, I'm not very sure whether I fully agree with your statement, whether the people have lost faith in the. I think you will always have all kinds of experiences, but in general, I would say that, and I think post-COVID, it has come back again as well, if there is some loss which was there. But technically speaking, I think, look at from a patient point of view, that let's say if I were a patient and I'm unwell, my end goal is to be well, to sort out my problems, right? Until that problem is sorted out, I will constantly, I'm very anxious, very nervous. Should I change and go to some other doctor? Should I take a second opinion? So constantly you're fighting against those emotions of whether I'm being looked after by somebody really well. And at times it's become very confusing as well, because unfortunately this Google has also is another doctor that exists in back of everyone's this one, and you go and Google it, and then that says something else, and it's not in line with what your doctor said. It's creating all kinds of confusion. But I think it's probably now falling in place where people have realized that medicine is not an exact science. You make a lot of judgments as you figure out what the issue is. And I think we have in our own personal lives many such situations where you actually don't know. And I think it's important to have that conversation with your doctor, because doctor is also trying to do its best to figure out what the issue is. But I think if there are some of these areas which are unfortunate, but I think overall faith is still there.
And how have you seen the business management style? Since you were talking of that, a lot of the challenges can be overcome by business models and business management, business leadership. How have how have you seen the business management styles change in the diagnostics industry with younger companies that are coming in who are disrupting the business models? We've seen aggressive marketing happening as against what we saw about a decade ago. And how has the leadership at Dr. Lal Pathlabs evolved with the times to retain its position in the industry?
So I think to my mind, this management leadership is a very important variable for growth of any business, I would say, not only just pathology.
Mhm.
Uh, any small and medium enterprise really struggles to grow big, mainly because of this management issues. To my mind, I would call it a one management style is under your nose, everything comes to your table, versus a distributed, decentralized, delegated style of management. I would say that's a very, very big difference, where it is not person dependent, it is a process dependent. So I think to my mind, that change with people like me coming in, having exposure in large organization, running through process, and I often say that it's not really important as to who makes the decision. It's important that we make the right decision. And in order to make a right decision, you have to have views of everybody else in the system. And I also often quote these examples. The small businesses, actually their way of controlling is who signs the check. But at some point in time, in my view of things, is that the signing a check is a clerical job, right? It's the time when you decided to do an activity, and that's the point you have to control. Because when you make a decision, that actually is going to make a big impact to the business, not when you are actually signing the check. By then, the damage is already done, right? You just so I think to management style, and that's one of the reason what I find is in healthcare system ecosystem, a lot of these small time hospitals, nursing homes, and labs, they are not cross over that hump. They are not able to cross over that hump of small size business to a large scale business. The second part of this management leadership is, I think this technology has brought in the customer acquisition process completely different than what it was happening earlier. Earlier, in healthcare generally, the source credibility of your brand essentially was doctor. If your doctor said it's a good quality lab, you took it as it is, right? Today, that same patient source of information is not just doctor alone. There is so much happening on internet, so much happening through mobile apps, so much happening through various other means of communication, social networks. I think the influence on the mind of customers about a particular brand and service is happening from many other directions than just only doctor. I would say that has brought in a lot of change. The customer acquisition process in the industry is very different than what it used to be, let's say, 5-10 years back.
Absolutely, I can't agree more with you on this. I remember, when I did my first healthcare project and I met doctors, they would always come and tell me that, Harbinder, we get our foot in the clinic only with word of mouth. And at least we know that the word of mouth will remain, but the word of mouth, the way it happens will change. I mean, from friends and family,
Yeah.
it changed to somebody unknown on the internet who comes and influences your decision.
Absolutely,
So
absolutely.
absolutely that has changed. So Om, what are the challenges that you feel that the diagnostics industry is facing today? For example, faster change in technology, the cost of equipment for doing business, the cost of doing business itself, the government regulations or the lack of it. What do you feel how we need to address? What are the challenges and how do you think we should be addressing these?
Uh, I, I, I think it's a great question. My sense is, as the scale of the industry in organized space is picking up, the entire value chain actually is requires very sharp focus. There's a The chain is collection of samples. The chain is about logistics. The chain is about testing. Uh, I think the biggest challenge the industry is facing is the moment of truth is actually with the patient is essentially when you collect a sample, because patient doesn't know much about this, what happens after the sample is collected. And then it's all about trust, right? The sample collection actually has become much more decentralized. Earlier, it was much more concentrated uh, in one place. Patients would walk into a lab or a collection center, but now a lot of it is moving towards home collection. They want people to come to their doorstep and collect the blood sample. Now, that essentially means is that you require a very large manpower of phlebotomists to collect these samples. And I think that's one challenge which I personally feel the entire professionalism. It's an opportunity as well, because if any enterprise can create a differentiation on this touch point, will be a winner as well. But I think industry is going to need a lot of these phlebotomists who are well qualified and also they're skilled to draw blood sample. I think that's one challenge that I see in the industry. And second is, since it's going to happen remotely, not under your nose, and much more fragmented than what it was before, so you need to be careful about the brand experience that happens remotely. So I would sum that up as a phlebotomy as an experience is has to get lifted. The second area is, as you mentioned, since largely this industry has been very, very city driven, very metro driven, right? As you go deeper, the logistics will gain even further importance on maintaining the quality of the sample. The integrity of the transport during the transportation is going to be very, very important for the sample. So I think that's another challenge which needs to be handled well. And it's still a very unorganized, informal network that operates in logistics in this business. To my mind, the testing actually has fairly well advanced. So you see a good quality labs these days, a lot of automation already inside the labs. But I would say the two challenges that would really get posed in front of industry as we grow, one is the collection, another is logistics. And yeah, shortage of doctors as well is another big thing because we don't have too many pathologists in the system. Hopefully, this AI and technology would then come and help us out.
And what is there a view on the shift in purchasing model for the labs when it comes to medical equipment or the testing equipment? Is there, there's been a lot of talk about made in India kind of an equipment. What is your personal view on uh, how soon the shift will happen from the procurement point of view for the equipment that has been made in India?
So let's say if I put myself in the situation, I'm more important for me. What is more important is quality, right? So and sheer economics itself. Quality at what cost? So I think I would look at that variable. I really won't differentiate that I have to buy something which is made in India or something which is coming from outside. For me, what is very important is whosoever adheres to the quality standards and provides me at the most efficient sort of a cost, I would go for that. Now, in general, broadly, whether make in India or will concept will probably, I don't think I'm competent to talk about this. I probably don't have much knowledge about these macro factors, but I know that there are a lot of medical parks coming up and a lot of incentives being given to people to start manufacturing in India. But from my point of view, I would look at any equipment which gives me a quality and economics wise, it's beneficial. So that's the way I would look at it.
This has been such an awesome conversation to understand about where the industry was, where is it headed to, and what is leading this transition. I mean, the clear message that emerged out of my, conversation with you is that it is still the relationship and the emotions that need to be answered, that build a relationship between the patient and the lab, or the doctor and the lab, the confidence that they have, the trust that they have, the faith that they have on the outcomes. Second is, you mentioned that we must understand that medicine is not the exact science. So go and have conversation with your doctor and try and understand how the solution can be provided. And third, understanding how and what will trigger the shift from a fragmented standalone clinic to a little larger percentage of an organized sector. Because the biggest problem, as I understand from what you've just told us, is that there is no data points available. There is no data flow which is happening in the organized sector. And even if it is just 15% of the total industry. So we really do not know the overall picture of the diagnostic industry. Hope this is going to change, and diagnostics business will be more organized than what we see today. Thank you so much for taking out time to speak with Business World Healthcare.
Thank you, Harbinder. Thank you for having me. Thank you.